right, so let's talk about the 5 delegation rights. So before we go off just saying you get a task, you get a task, you get a task, there are 5 rights that we need to check off when we are delegating a task to someone. So the first one is the right task. We want to make sure that we are delegating tasks that are within the scope of practice of the person that you are delegating to. So you're like, Dr. Bonnet, so you mean to tell me I have to know the scope of practice of the people that I'm delegating to? Yes. You have to know what an LPN can and can't do and what a CNA can and can't do. And each state is different about, what a CNA or LPN can't do. So it is really important that you follow your facility policies and your state scope of practice. So the next one is the right circumstance. You guys, this is so important. When we are delegating, we want to make sure that we are delegating stable patients. So this means we're delegating patients that are, they're doing just fine. They're stable. They're not critical patients. So let's say that we have a simple task of like feeding a patient, right? We got a simple task that we can easily let a CNA do. It's feed the patient, right? But let's say that this patient just had a stroke and every few bites they are aspirating. Guess what? That patient is not stable. So even though it's a task that the CNA can do, which is feed a patient, but in this circumstance, this patient is not stable. This patient is aspirating all the time. So this would not be a patient to assign to the CNA. So the biggest thing is making sure, when it talks about right circumstances, making sure that this patient is stable. So if this patient needs like a continual assessment, if this patient needs close monitoring, guess what? We're not going to delegate that patient to a CNA. And also, we wouldn't even delegate them to an LPN. So we want to make sure that we are stable. We are delegating to stable patients, okay? So the next one is the right person. We want to make sure that we are delegating tasks to the appropriate person. And that kind of goes with the right task. So let's say that you, the right person, so let's say that you need medications passed. You're not going to ask the CNA to do that because that is not in the CNA scope of practice. But you could ask the LPN to do that. Or let's say you have the dietary person in the room. You're not going to delegate them to take the patient to the restroom, right? So you want to make sure that you're delegating to the right person. So the next one is the right direction and the right communication. So you just don't want to delegate something just like go do that. No, you want to communicate. So like for example, let's say that you're delegating a blood sugar check. What you want to do is you want to tell that CNA, hey, can you go get the blood sugar in room 203, and then I want you to report back to me, and you want to give, you just want to give right direction and right communication. Let's say if the blood sugar reading was less than 70. So you then want to tell them, hey, if the blood sugar range is this, I want you then to report back to me. You want to give them clear direction and you want to give clear communication, because you don't want there to be any type of miscommunication. So anytime that you're delegating, you want to make sure that you're giving clear directions, okay? And at this time, it is also important to ask the person that you're delegating to, hey, do you feel comfortable with this? Like, I know that this is a skill that you should know already, but I don't want to assume, is this a skill that you're comfortable with? So right here is a good time to be communicating with that person to see, how they feel about doing that task, okay? You never want to never assume that someone knows how to do something. You don't never want to assume. You want to give right direction and clear communication. All right. So the next one is right supervision and evaluation. So you're not just going to tell them to go do something and then, you just forget totally about it and say, hey, it's on them. Because the biggest thing to remember, even when you are delegating tasks, you are still responsible for that patient. So we as the RN, guess what? We take all responsibility. So it is important that you are supervising, so that you go back in the chart and you look at that blood sugar reading. You go back in the chart and you look at that blood pressure reading. Like, you just can't tell them to do something and you just totally forget about it. You have to supervise them and evaluate. And this also will be a time for you to monitor the progress of the delegated tasks. You guys, it is so important. Always, like, back to the step that we just talked about clear communication. Letting them know, like, hey, I told you to have the blood pressure at 9 o'clock. It's now 9:15. Is there something that is preventing you from getting this task done? You know, you want to make sure that we are monitoring the progress